This is Dr. Bill Wyatt again, and I'm glad to have you this morning. And I'll have another case here showing the use of deciduous teeth. We just make a lot of use out of them, and this will be where we reduce the size of the tooth to do pulpotomies and things like this to get the teeth lined up like we want. Now, this young lady that we'll show has got a very straight facial profile. In fact, it's a little caved in, but not bad. And we definitely are not going to take any teeth out, but she's got a little crowded problem, but not a serious one. And we'll show how we work around this problem. Here she's got a good facial height and all this, just a little bit of a, not exactly straight facial profile, but you don't want to take any teeth out on a person like this. All right, here the models are. She's got a pretty much class 1 relation on the left side, but I think the right side may be slightly class 2-ish. So we'll go into treat. It's a pretty simple orthodontic case to show. And over on this right side of the mouth, it's pretty much class 1 at this point. And the left side is slightly class 2-ish. You see the molars kind of up on top of the other molar. And we'll go ahead and go through this pretty quick. And so it looks like we've nearly got room enough there for the teeth to come in. We really do have enough, and we're going to see that. Down on the bottom, you're a little crowded just down there, but we have a lot of excess room up in this portion. You can take the teeth down and get those teeth in there just exactly like you want them. Now here we start with the orthodontics, and we use the step down arch over here on the right side of the mouth. We'll come out, step down, go back up in front of this molar, and we're going to hold the space open on that tooth. Probably show more on the when you look at the panrex of the teeth. All right, here's 2 deciduous molars still in place. In fact, the first deciduous molar excuse me, is in place there also, and we'll have to go here and see what we're talking about. So we had a little problem getting the first bias in, so we did a pulpotomy on each of these deciduous second molars, and I've done thousands of these pulpotomies, and I've never had any problem with them. And we just pack really stiff zinc oxide and eugenol in them and nothing else. Just pack that, just mix it, but blot it out to where you can pack it almost like amalgam. And we just go in with a round burr and on a tooth like this, and we just take this center part out and go down and pack it right in there, and never had any problem with them. Now, if we don't do this on tooth that's abscessed or anything like that, you have too much problem. But these have been vital teeth, and while they're bleeding, we pack them. We don't use a rubber dam or anything, because you get it in there and you grind into the rubber dam when you're trying to get into the pulp. So we've done, I know, 1,000 or more, and I, honest to God, have never had any problem with one. Now, I had a patient I had another dentist, didn't want to do his own, and I didn't want to get to him, but didn't have time, and he wouldn't do them. He sent it to an oral surgeon who was a MD oral surgeon, and he did not know how to do it, and those went bad. I mean, he just put some soft zinc oxide eugenol over it. You got to go down in there, take the nerve out, and pack it hard. and I've never had any problem. But we do this a lot of times in deciduous teeth so that we can take advantage of this room we have over these teeth, and that this will have plenty of room for the second bicuspid to erupt in there, and you have this cinch deal. But let's look at it on the x-rays. I haven't shown that it's lined up real good and everything's going great with the case. Now down on this particular tooth right here, it wasn't coming in properly, so we put this step down arch on there to hold that space open. That's a easy arch to make, but it does a lot of things. You expand the gap, or you can reduce it, or you can hold it like it is, and you have to get this down here, just lay it flat on the tissue, coming up to this tooth and going back, and it'll hold that space open. Or you can increase it, and as you increase it, it moves the roots like you want it to, and if you close up with it, it'll also move the roots in the direction you want them to go, same way as the crown. All right, the upper arch has still got those deciduous teeth in it, and then we're going to go ahead and get it on the x-ray. Now here's just the x-ray we used to start the case with, and this is a very flat facial profile. I wouldn't call it a dished in facial very much. It's just slightly, not enough to make it look bad. So we don't try to enlarge that or anything. We did expand it some to get the teeth in. All right, now this bicuspid right over here was coming in pretty good. You see where the permanent tooth is? That thing jumps up there. All right, you see where it jumps up there. Now this bicuspid here hasn't eaten the root away at all, so we've got a problem getting this in. And this is where we had to, we took this down like this and then did the pulpotomy on it, and I think we did the same thing over here on this one just to keep room for it to come in, but it is resorbing the root property here, but not over here. Now you'll have that every once in a while, and I'll go with you, show you what we did on this particular case. Now, all right, we do the pulpotomies, and you see we went in and packed the zinc oxide and eugenol in that tooth, and this one we've already lost it, but we got a couple of them coming in up here, but I think they're going to make it without any big problem. Now this one has a root that is sticking down in here, and when you've got to take this tooth out, and it's hard to get this root to, sometimes it's eaten off and there'll be a little bit of that root left. You don't need to dig it out, it's just root structure, and as this tooth comes on up in, it'll dissolve this root structure here. But it's so far in front of it now, it's run up in here and it's got this root that's holding this down. Now the tooth wants to come in, and we've got to hold this space open until that tooth comes in. Of course, it's going to slow you down on the case. You need to show it to the parents or the people, and so you've got a reason for holding the braces or keeping it open, everything, until you can get that tooth up in position. Okay, we got it in there, obviously, and this is 1987, and that was 86. So we took that off, and this that tooth just shot on up in there pretty quick, and the ones up above came in good, and we just had it pretty well made on that particular case, and we lined it all up and come in. That's nearly class 1. It'll probably slide in position there, and you can see the omegas on the deal where we tie this arch wire back and close that up, and we put these omegas on nearly every case that we put in, and we can take them in and out. You see, if you bend the end of the arch wire there, you got to cut it off, and you'll have to make a new one each time. So we just put these omegas in, and we've got videos showing you how to do that. And these are the two cases. And there's the one that was late coming in, but we got it in, and we got to shape that arch up a little. And this is 1987, and here's 88, and we've kind of shaped the arch slightly, and that tooth is still. Now this is something I shouldn't have done. I bracketed that tooth too quick. You really ought to take this off now and put the bracket, and you may have to take something and take some of that gum tissue away to put the bracket up where it ought to be, and that would be better. Now there the tooth is. It was up too high, and here we are. We've taken it out, but we did something to help that tooth come on down in the position, and there it is. After we got it out, it moved in real good, and this is socked in. So that's just another use of deciduous teeth, and I hope you get something out of this. I've shown you a bunch of cases on that, so you can go and look at different things we did to get out of the problem and use that. Now we normally don't leave these lower anteriors. We put them on now, put the 3 to 3 on the back side before we take the arch wire out, and we didn't in that case. Now this is the upper arch, and we put a little bite plate. You can see in the bite plate is, and those lower teeth fit right in this spot right here. And if the person wears this thing, it's hard for those teeth to change right in there. However, I feel like it's pretty good to bond a 3 to 3 on some of the cases like that, and still put a bite plate in there. All right, we look on the bottom arch, and we don't have, well, sorry, that's the upper arch again. And here's our young lady, and the profile is still straight. We didn't enlarge it any. This is the lower arch. We close that out. Here she is again, and that's the way we finished up. This is 1989, and the bite is closed out. She's got a good overbite and overjet and everything, so when she bites her teeth together out here in the front, the back teeth don't hit. It just loads between the condyle and the anterior teeth. And hope you get something from this and can do this. And I think this is the best way you finish a tooth, finish a case, and you put the retainer in, but there's nothing to keep these teeth from erupting together. And you leave them in a few months and look at them, and they'll be much better. But if you've got these little shells on here, you've got stuff between the teeth, and they can't ever come together like that. So it's far better to go in and put a wraparound retainer in there, and the teeth can come together like that. Okay? Other side's coming in. That tooth is not in as good as the other, but it is in there. And this is the upper, and I think we've got one more picture here on the lower, and that finishes it up. Thank you for watching, and we'll hope you come back again and keep up, and we hope you'll subscribe to our channel, and we'll keep trying to show different things. I guess we've gone through orthodontics from the preventive and interceptive and adult orthodontics and surgical orthodontics and everything related in orthodontics. And I feel like people need to know how it's done, and if you're just an individual looking at it and your dentist or the orthodontist or whoever's doing your teeth, if you're not having the proper thing done, just take it, let them look at it. I'm going to hang up here and close out. Thanks for watching, and I'll say goodbye for the time being.